my viewers, welcome back to my YouTube channel, and on today's video we're going to talk about ectopic pregnancy. I know many of you have heard of this name, but today we're going to check into details what it is all about. So let us begin our video. In an ectopic pregnancy, the fertilized ovum fails to reach the uterine cavity, becoming trapped instead in the fallopian tube and growing in its cavity. Let me repeat this. In an ectopic pregnancy, the fertilized ovum fails to reach the uterine cavity, becoming trapped instead in the fallopian tube and growing in its cavity. In an ectopic pregnancy, it usually proceeds only to about 8 to 10 weeks. And at this point the tube usually bursts. It exceeds to 8 to 10 weeks, and at this point the tube usually bursts. And before this, there may be symptoms that signal all is not well, although in many cases it usually happens, it comes as a surprise. And I want us to check on these symptoms, so that when you happen to see them, please take it as an emergency. One is you might experience very severe nausea or vomiting several times within a short period, say like 2 hours. And another one, severe headache that doesn't go away, particularly in the second half of pregnancy. And number 3, a fever of that 7.8 and above. And above, you might experience that. That is, you might experience a fever of that 7.8 or above, in this period. And number 4, a sudden reduction in the amount of urine you pass. For example, if you don't urinate like 24 hours, for like 24 hours, even though you taking normal quantities of fluid during that time. And number 5 is rupture of membranes. And number 6, absence of fetal movement for 24 hours from the 30th week of your pregnancy onwards. Absence of fetal movement. And number 7 is sudden swelling of the ankles, feet, fingers, and face. And number 8 is sudden blurring of vision. Sudden blurring of vision. And number 9 is acute abdominal pain, often beginning on one side or the other. Acute abdominal pain, often beginning on one side or the other. And number 10, often with vaginal bleeding. You experience bleeding during this time. You experience bleeding while you are pregnant. And that is number 10 is rapid and weak pulse. That is a later sign. Rapid and weak pulse, it is a later sign. And the last one is low blood pressure, and it is also a very this is also a very late sign. That is low blood pressure. And problems related to ectopic pregnancy, to this condition uh, remember, are seen early in pregnancy. So be an observant, be a good observant. These problems are seen early in pregnancy. Yes, and those those women with these signs that I've said indicate shock due to internal bleeding. Yeah, and this condition, please take it serious. This condition can be life threatening, and as the saying goes, any woman over childbearing age with abdominal pain has an ectopic pregnancy until proven otherwise by the physician in the emergency department. Let me repeat this. Any woman over childbearing age with abdominal pain has an ectopic pregnancy until proven otherwise by the physician in the emergency department. And be alert to recognize no, let us check now. Let me check on the when you get these symptoms. Yes, you as a patient, yes, when you get these symptoms, and this is emergency. Yeah, so what is the patient care? Yes, what is the patient care with these symptoms? Yes, so number one, I want to talk of the care. Yes, it consider the need for immediate transport to the hospital. Yes, consider the need for immediate transport from where you are to the hospital. Consider an immediate transport from where you are to the hospital. And number two, position the patient for shock. Position the patient for shock. Now you are assisting this patient. And number three, please take care for shock, yes, of the patient. Yeah, and the last one is provide high concentration oxygen by non-breather mask. Yes, provide high concentration oxygen by non-breather mask. Yes, and let me finish. And the last one is do not give the patient anything by mouth. Yes, when you are taking care of this patient that has these symptoms, please do not give the patient anything by mouth. It is very dangerous. Yes, and as I am finishing to do away with this, there is no medication that can heal this ectopic pregnancy. There is no reversal. There is no reversal of an ectopic pregnancy. The only way, the only solution of this ectopic pregnancy is by surgically removing it from the fallopian tube. It is only by surgically removing it from the fallopian tube. Yes, so you are surgically removed the pregnancy from the fallopian tube. And unfortunately, fertility is reduced after one ectopic pregnancy. Fertility is reduced after one ectopic pregnancy. So if you happen to have two ectopic pregnancies, just know your fertility is going down. Yes, law by law, it is going law by law. Yes, and uh, we need to ask ourselves this question: what really causes ectopic pregnancy? Yes, what really triggers this ectopic pregnancy? Yes, it mostly happens. Ectopic pregnancy increase has increased due to the blockage of uh, due to the use of IUCDs, which causes inflammation and blockage of the fallopian tube. Listen to this again. Ectopic pregnancy